My friends, I know that fiber in the diet does not sound like a very exciting topic for a video, but do you know how many NCLEX questions have the right answer be increase the fiber in your diet? Well, a lot of them do. So let's talk about it. You don't want to miss them. They're pretty fundamental. Do you know what the side effects of too much fiber is? Do you know what happens if you increase the fiber in your diet too quickly and so forth? So let's talk about those. No reason to miss those. That's coming right up. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today we're talking about fiber in the diet. Whoo, that's exciting, isn't it? For people my age, I'm like, hey, I need to know about fiber in the diet. But I realize for people, probably most of you watching this, fiber in your diet is not a big issue, but it's something you can definitely see on NCLEX. And those nutrition questions, those are the worst. I hate nutrition questions. It's sort of a nutrition question. So we are part here at YouTube. We're a part of the bigger Clinic Review family. We're glad you're a part of our Clinic Review family. And we offer the very best NCLEX review in the entire universe, IMO. Thank you for those of you who sent me messages with IMO in it. I appreciate that. And we also have streaming videos that are what you see here on YouTube. And Mark is adding to those videos. Those are not going to be here on YouTube. Mark is recording some videos just for the streaming service. That's a pretty reasonable monthly fee of $19, I think, for the streaming service through Clinic Reviews. And we also do small group tutoring. All right, business is out of the way. Let's go ahead and get started with what we're going to talk about today. A patient is asking the nurse about foods that are high in fiber. Which of the following foods should the nurse recommend? Select all that apply. Wheat bread, apples, broccoli, brown rice, milk, cheese, graham crackers, or rolled oats. So any kind of grain is high in fiber. Okay, grain is high in fiber. You don't want white or processed anything, but if it's got grain in it, it's got a natural grain or a whole wheat, bran, oats, that kind of stuff, that all's high in fiber. And then fruits and vegetables are also really good options. So what do we have here? Wheat bread, that's a grain bread. Apples, that's fruit. Broccoli, that's vegetables. Brown rice. Brown rice is good. White, I wouldn't pick anything that says white in it. So brown rice is good. Milk, nope. Milk, dairy products are not high in fiber. Milk and cheese are out. Graham crackers, yeah, that's not a grain, y'all. Rolled oats is a grain. Any kind of oats, if they say rolled oats or oatmeal, would be fine. So those are all high in fiber. Those are good sources of fiber. The nurse is educating a patient about the benefits of a high fiber diet, which of the following is a primary benefit of increasing fiber intake. So there's a lot of reasons to increase fiber in your diet. It decreases your risk for colon cancer. It stabilizes your bowels. So if you have diarrhea, it tends to cut back on the diarrhea. If you have constipation, it tends to prevent constipation so you can have more normal bowel movements. And it has some other benefits as well. So I'm looking for those things here when I look at that, right? Improve vitamin absorption, regulation of blood sugar levels, increase bone density or slow absorption of minerals. Okay, so what I was looking for isn't here. So what do you do when what you're looking for isn't there? Then you have to go, okay, I'm going to have to use my common sense and clinical reasoning. So just so you know, fiber does slow absorption of vitamins and minerals. Okay, it slows absorption of vitamins and minerals. That's not a benefit, though. That's actually more of kind of a side effect, an adverse effect. You just have to realize that that's the case. So we don't have improved vitamin absorption, and we do have slowed absorption of minerals, but that's not a benefit. And we have to pay attention. That says a primary benefit. So I'm going to cross off A and D. Regulation of blood sugar levels or increased bone density. Well, increased bone density would only be occurring if I have weight-bearing exercise or if I can have better absorption of calcium. And calcium is a mineral, and we have slowed absorption of minerals. So increased bone density doesn't make any sense if I'm just using my common sense. So it doesn't make sense that we'd have a regulation of blood sugar levels. Well, if it slows absorption of things, then I guess it could regulate blood sugar levels. It could prevent hyperglycemia, and it probably could even prevent hypoglycemia because if you have an immediate absorption of sugar and then you have like this sugar high and then it drops off, then you become hypoglycemic. So if it sort of slows absorption of things, then it seems like it would make sense that it would regulate blood sugar levels. So even though that's not something I have memorized as it relates to fiber, that's the only one that makes sense if I use my common sense and my clinical reasoning. And y'all, don't throw your common sense out the window. You're going to get questions that you're not going to know the answer to. So you have to be able to understand the concepts, which is why fiber in the diet is a good concept to review, because it's not just about memorizing facts. Although, and I did forget to mention, we are doing the blue book right now. The blue book is back there. Somebody asked me the other day, what's the name of the blue book? Y'all, the name of the blue book is The Blue Book. Okay, it's The Blue Book. That's the name of it. It's written by Mark Klimek. It's a list of facts. What are we doing today? I think it's page 80 something. I could be completely wrong. I have a tendency to totally forget what page we're on, but I think it's page 80 something, fiber in the diet. There are facts there you can memorize. What I'm doing is turning these facts into questions to help you understand them better. Which of the following statements made by a patient indicates a need for further teaching regarding fiber intake? Further teaching means false statement. Further, false, F goes with F. So I'm looking for the false statement as it relates to fiber. I will increase my fiber intake slowly to avoid stomach upset. I will increase my fiber intake slowly to avoid stomach upset. Well, I know that if we increase anything too quickly, I mean, not antibiotics or anything like that. That's not what I'm talking about, but like dietary changes. If you made rapid dietary changes, that can cause problems. And it makes sense it would cause some kind of stomach upset because the stomach is really sensitive to dietary changes. So it seems like you should increase your fiber slowly. That makes sense to me. A seems like a true statement. So we need false statements. So drinking plenty of water helps fiber work better in my digestive system. Well, that seems to make sense to me. I know that you have to drink a full glass of water if you're taking a fiber supplement. Like if you're using Metamucil or anything like that for fiber, it has to go to a full glass of water. So it makes sense that water would help fiber work better. So that seems like a true statement. Remember, I'm looking for the false statement. I should aim for at least 25 to 30 grams of fiber per day. I don't have the amount of grams memorized, but that doesn't seem like an excessive amount. I will increase fiber from eating more meat. Well, I'm not sure about C, but I know D is false because I know there's meat is not a good source of fiber. Okay, we talked about what will be a good source of fiber. Y'all, look at what I did. When I was making this, I forgot what I was looking for. I forgot when I was making these questions up that I was looking for the false statement. The correct answer is D. I accidentally selected A. Look, I do that too. Y'all, you got to pay attention whether you're looking for the false or the true statement. I make those same mistakes. This is wrong. The correct answer is D. I will increase fiber from eating more meat. I chose the wrong answer because A is true, B is true, C is true, D is false. Oh, Sharon. The nurse is caring for a patient who has increased their fiber intake significantly. Which of the following side effects should the nurse monitor for? Hypoglycemia, constipation, flatulence, or bradycardia? Well, fiber doesn't have anything to do with the heart, so I'm crossing that one off. I know it doesn't cause constipation. I mean, it can cause constipation if I don't drink enough water with it, but generally speaking, constipation is not a side effect of fiber. In fact, fiber helps prevent constipation. Hypoglycemia, it regulates blood sugar levels, so it doesn't make sense that increasing your fiber would cause hypoglycemia. But gas, flatulence is a side effect of increased fiber in your diet. So that's just a fact you kind of need to know. Which of the following statements indicate the patient understands the education provided by the nurse about foods that contain fiber? All right, education about foods that contain fiber, understand. So I'm looking for the true statement. Whew, let's see if I did it right because I mislabeled this one too. I'm looking for the true statement. It understands it. I will peel all my apples before eating them. No, don't choose to peel anything. When you peel things, it loses fiber. A lot of the fiber in the apples or any fruit is in the peeling. So, I mean, you can peel bananas, you can peel oranges. There's some you need to peel. But if you can avoid peeling it, avoid peeling it. It's not a good option. So anything peeled is not the best option for fiber in the diet. So you can get fiber in bananas, but if you peel it, it has less fiber. I will always cook any vegetables I eat. I always cook any vegetables I eat them before I eat them. I don't know. Sharon, you've got a problem here. Anyway, don't cook it. When you cook veggies, it loses fiber. Okay. Cooking veggies loses fiber. So uncooked is better, and steamed is okay. Steamed is fine, but cooked is not good. So uncooked or fresh or steamed veggies are fine. White rice is a good source of fiber. False. White is never a good option. I will avoid refined carbohydrates. Well, that's true. Refined carbohydrates give you no fiber. So D is the true statement. They should avoid refined carbohydrates. So A, B, and C should all be corrected. Those are all teaching things that you should correct. A patient on a high fiber diet reports bloating and abdominal discomfort. What should the nurse recommend to alleviate these symptoms? Introduce fiber gradually, reduce fluid intake, increase exercise, cut back on fiber immediately. So reducing fluid intake is bad. I'm crossing that one off. Increase exercise. You know, if it were constipation, I would say increasing exercise, but bloating and abdominal discomfort is not something that I generally say to increase exercise. It wouldn't hurt to increase exercise, but it's not best. So I'm going to keep a question mark next to it in case nothing else makes any sense, but it doesn't seem like the best option. Cut back on fiber immediately. No, I don't want to do any quick, immediate changes. That doesn't seem like a good NCLEX answer. Introduce fiber gradually. So we've put them on a high fiber diet. They've increased their fiber, and now they're having bloating and abdominal discomfort. So the best thing you can do is say, let's cut back on the fiber, not discontinue it completely, but cut back on it, and let's reintroduce it gradually. So A is sort of an umbrella answer for D, because in order to introduce it gradually, you have to cut back on it. So A is just a better answer than D. And C is certainly not the best answer. B is completely wrong. So A is the best answer out of these four answers. A patient with IBS is seeking advice on fiber intake. What type of fiber is generally recommended to help manage IBS? Insoluble fiber, soluble fiber, high-fat fiber, low-residue fiber. Okay, I don't even know if C and D are real things. And I don't know why I would want to take in insoluble fiber. I mean, you need to use, it doesn't make any sense that I would do insoluble fiber. So soluble fiber is the type of fiber that they want to have. All right. This is educating a group of patients on increasing dietary fiber. Which recommendations is most appropriate? So I'm looking for a true statement. Substitute beans for meat in some meals. So beans are a veggie. They are high in fiber. I assume they're talking about like black beans and stuff like that. So I could substitute beans for meat. That seems reasonable. And it says in some meals. So that would increase fiber and it wouldn't cut meat out altogether. So that seems reasonable. A seems like fine. Eat only fruits for fiber intake. Well, no, there's fiber in lots of other things, including veggies and grains. So B doesn't make any sense. Only is not a good NCLEX word. Avoid nuts as they contain no fiber. Well, just because they contain no fiber doesn't mean I have to avoid them. I don't want to just do nuts in my diet, but I certainly don't have to avoid them. No reason for that. So C is not a good NCLEX answer. Drink juice instead of eating whole fruits. No, because you don't have the peeling in that. The peeling is what you need. There's a lot of sugar in fruit juices. So I don't like D. So A makes the most sense. Okay, A makes the most sense. This is a great example of a common sense question. This is not something that you memorized. Y'all, you're going to get questions that will not have memorized the answers to. You want to be able to use common sense and clinical reasoning and think through it to answer the question. It's not hard. Just because you have to use clinical reasoning doesn't mean it's hard, but you have to have faith in your own ability to clinically reason. So make sure you're growing and gaining confidence in your own ability to clinically reason. Following the acute stage of diverticulitis, which foods should the nurse encourage a client to incorporate into the diet? Well, so the only thing I know about diverticulitis, it's a disease where things get stuck in small pouches. So diverticulitis is the inflammation of the diverticulosis. So people has diverticulosis. They'll have an acute inflammation that's called diverticulitis. And I know we want to decrease the types of foods that can get stuck in those little pouches, like nuts. We avoid those kinds of things, for example. So let me see what they have here. Bran cereal, broccoli, tomato juice, navy beans, or cheese. So I don't see any foods here that just like red flag me for diverticulitis or diverticulosis. So then I say, well, then what are they asking me here? What do I know about bran cereal? Well, bran is a grain, so I know that's high in fiber. Broccoli is a veggie, so I know that's high in fiber. Tomato juice, that juices typically are not high in fiber. Navy beans are beans. It's a veggie. Seems like it would be high in fiber. Cheese, which is dairy, is not high in fiber. So those are the foods that are high in fiber, and those make the most sense to me. So again, it's not a hard question per se. It doesn't require like really complicated thinking or anything like that, but you have to be able to use your common sense. All right, we'll move on. A patient at risk for colorectal cancer asked the nurse, "Can you tell me some foods to include in my diet so that I can reduce my chances of getting this disease? Which dietary selection does the nurse suggest?" Well, I know that increased fiber decreases the risk for colon cancer. So let's see what the answers are. Steak with pasta, spaghetti with tomato sauce, steamed broccoli with turkey, tuna salad with wheat crackers. Steak with pasta is meat. I don't know what the pasta is, so I'm not going to go with that one. Spaghetti with tomato sauce. There's nothing there that tells me it's high in fiber. Steamed broccoli is high in fiber. I like that one. And turkey, there's nothing special about that. Tuna salad, nothing special about that. Wheat crackers are fine. Which do I like better? So that's the question. Which do I like better? I like the steamed broccoli better, y'all. I just like that better. That's a high fiber food and I like it. So that's the one I'm going to go with. Okay. The nurse is teaching a patient who has undergone a hemorrhoidectomy about a follow-up plan of care. Which patient's statement demonstrates a correct understanding of the nurse's instructions? Hemorrhoidectomy. So hemorrhoidectomy, I don't want to strain with having bowel movements. It doesn't mean I want to constipate them. It means I want the stools to be soft. That's what I say to myself when I think post-hemorrhoidectomy. I want my stools to be soft. I would take NCLEX after surgery to keep things moving. No, that's not a good NCLEX answer. I will need to eat a diet high in fiber. I like that. High fiber diet will keep stools soft. Limiting my fluids will help me with constipation. No, that does not help with constipation at all. To help with the pain, I'll apply ice to the surgical area. Maybe, but the question is, after teaching patients who's undergone a hemorrhoidectomy about a follow-up plan of care, which patient statement demonstrates the correct understanding? So which is more likely to be the correct statement? I'll eat a diet high in fiber. I know that's right. To help with the pain, I'll apply ice to the surgical area. I've never told anybody to apply ice to the hemorrhoidectomy surgical area. I've never done that, but I have told patients to eat a high fiber diet. So that's the one I'm going to go with. So just using my common sense and saying which one just makes more sense, y'all. That's all I'm saying to myself is which one makes more sense. So that's it. I hope you enjoyed that video. I've seen lots of NCLEX questions where high fiber diet is the correct answer. And don't forget that not only do we start fiber slowly, we start tube feedings slowly. So if you are told you have an order to run tube feedings at say 75 mils an hour, and they ask how you're going to start it, you're going to start it slowly. So you're going to turn it up over time until you get to the correct hourly dose of running it in. Okay. So you start fiber slowly, you start tube feeding slowly. All right. Well, good luck on your NCLEX. Good luck on your standardized test that you may have to take. Good luck on your next unit exam. And I will see you later. Thanks for being part of our clinic family.